The coronavirus has spread to 25 other countries. The Philippines, Japan, and France have each reported one death. Now, many more aboard a cruise ship in Japan have confirmed to have been infected, pushing the confirmed cases in Japan the largest number outside China. The Japanese government is strengthening the screening and treatment capacity in case of an emergency. On Sunday, some 400 American passengers were evacuated from the cruise ship. Japanese Prime Minister Shinzo Abe says the rest of the quarantined passengers will be able to leave the ship after the final health check this week. For more on the new coronavirus outbreak in Japan, particularly on that cruise ship, I'm joined in Tokyo by Koji Wada, Professor of Faculty of Medicine at the International University of Health and Welfare. Over the past weeks, Professor Wada had been on board that cruise ship and been talking to the patients on it. So thank you so much, Professor, for joining us. Tell me how the situation has been evolving and whether effective this quarantine has been, not only for people who are not on board, but also for people who have been on board, because we've seen the cases have been ever rising since the quarantine begins. How should we understand it?
Obviously, there was an outbreak in the cruise ship, unfortunately. But I think that everybody on board were really calm, and there are not so many people get panic, and they are still gentle, and they respond to us very diligently, so that we, supporters, have not so much difficulties in communicating with the passengers. As long as I understand, almost all the people who are going to disembark on 19th with the negative result are going to be able to back to their home. No more quarantined. But maybe there may be some arguments. If for the Japanese people, public health centers, everywhere in Japan may contact those passengers if they are still okay or they are getting sick. So that kind of additional things may be considered.
So they will be home quarantined, or they can just go home and do whatever they want?
Basically, as long as I understand, no home quarantine will be enforced for all the passengers. But of course, maybe we may have some kind of support for those who are going to disembark.
Professor Wada.
Some people are really worrying about their symptoms, also the infectivity. So maybe they may have lots of questions. So the public health center can support for those people.
Was there one or two conversations you had with the passengers on board, whether they are being affected or not infected, been talking to you? Do you still remember one of those conversations?
I talked about the symptoms they have, and I heard that many patients say my fever gets up and down. So yesterday high fever, but the another day going to be below the 37.5, but another day going to up. And also many people have a complaint about no appetite. So they don't want to eat a meal. They don't want to have they don't want to have meal. So they want to have the fresh fruits. So the cruise ship also offered fruits for the passengers.
How prepared are the local communities, Professor Wada, in Japan? Because we're talking about disembarking of a few hundreds of people off the ship, and they are likely without symptom going on with their life. So how prepared are the local communities for that, whether it's about medical supply, whether it's about treatment, whether it's about quarantine, whether it's about the basic knowledge of protecting themselves, Professor?
Yes, the most important thing for the passengers not to be like to be looked at from the certain prejudice, like a kind of discrimination or not to want to talk to meet or something. So we really need to be careful, not happen such a discrimination or like human dignity issues. But yes, of course, the passengers on board may understand very well about the infectivity of the virus, and also the they may scare very much. So I do not worry about they may spread the virus to the others, because they have already learned a lot of things how to control the disease in the ship. So, but the point is, maybe we have several cases in Japan already in the community. So everybody should have very good precautions. And the Japanese government has just declared we are now the phase of the epidemic initiation of an epidemic period. But still, it's not the curve. Epic curve is not really peaked, but it's the most important time to control this disease. Yeah. So now the government and also the media encourage people to have very good hygiene practices, like hand washing or some other things, so that maybe we may control the coronavirus in Japan.
Yeah. Japan is to host the Summer Olympic Games. Now, I know the Japanese people have been preparing for this for years. It's going to be a big event and a great event according to the plan. But now we have some difficulties, as you may know, as a result of public health crisis. So how
Yes.
do you, from a health expert's perspective, look at this? I mean, on the one hand, you need to still prepare, make sure there's no plan B. It's going to be on the schedule. On the other hand, there is, in reality, a public health crisis, as you said, initiation stage going on right there.
Yes, we are going to have the Olympics, and now that it's a very important period. But I have a very positive mind, because we have this outbreak before the 5-6 months before the Olympics. So we have certain time to discuss how we can conduct the Olympics safely. So of course, now that we are going to face the early phase of the epidemic period, but once we may control this period, but this is also very optimistic. But you know, the coronavirus is a part of the virus which can cause cold symptoms, and those coronavirus easily spread during the winter time, like this, like the Chinese, the spread in China in the really winter time. But hopefully, after like the weather gets warmer, and in May or July it's going to be hot, so that hopefully the virus peak can be down. And of course, there may be maybe the southern hemisphere, they are going to be the winter time, and it can be spread possibly. But we hope we may have lots of things we can do to have the Olympics in the same period, and everybody may want to come to the Olympics in Tokyo as well.
Yeah, and another thing is about, you know, Japan been helping China, whether it's from the civil society or is it from a government's perspective, businesses as well, supporting China with medical supply, with face masks, with PPE clothes, you know, wear by the medical workers. So here in China, people are very grateful about what Japan has been doing over the past few weeks. Tell me about, from a health expert's perspective, how do you see this momentum going on in Japan about helping China out of this rather public health crisis?
Yes. Yes, we are very proud of having the very good relationship with China. And I know that there are so many people have sent the face mask or some other alcohol sanitizer to China. And of course, we are also suffering from the shortage of the face mask and also this hand sanitization. But in Japan, we also are trying to produce those products by themselves. And we are trying to disseminate to the older people who wants to have.
Professor Wada, final words from you. Anything as a health expert and as someone who are talking to our international audience, also including Chinese
yes.
audience, anything to share?
Maybe two things. One is for the international cruise ship. So there were some other cruise ships who have had a difficult time during this period. And we do not have the clear rule for how we can handle these issues. So the cruise industry and also the international regulations should be discussed for controlling this situation in the future.
I see.
Another thing is we have learned a lot from China, especially for the controlling the disease. And I also heard that many healthcare workers have been infected. And I'm really sorry to hear that. But that also gives us very good lessons for us. So the infectivity is very strong comparing with other diseases recently we faced. So we Japanese healthcare workers are also trying to have very good precautions and not to be infected themselves.
Right.
And I hope the Chinese healthcare workers are going to be well and also controlling this disease. And we also want to have the good communication and good relationship with China.
Professor Koji Wada, Professor of Faculty of Medicine at the International University of Health and Welfare, thank you so much for sharing your experiences with the cruise ship and also the latest cases in Japan. All the best to your people. Thank you, sir.
Thank you.
Thank you very much.